Thank you so much for joining us today. I'll let you guys first introduce yourselves and share whatever you feel comfortable sharing about how you come to be here.
My name's Pam Venable, and I'm a current patient of Dr. Truong's. And I was first diagnosed with cancer in 2011. It was breast cancer. And I had surgery and had the mastectomy and was cancer-free for 1.5 years. Then we went to see my son, who was going through training to be a medic in the Army. And I had a lymph node in the back of my neck that just protruded out. And, I didn't think anything of it. But it lasted for like 3 months. And I went to my primary, and he thought I had a sinus infection and treated me for it, but it was still there. So I asked to go see an ears, nose, and throat doctor. And he looked at it, and he biopsied it, and I had melanoma stage 3B. And he goes, since it was here, he says, there's got to be something, a primary. Well, I had a mole on the top of my head, and I had gone to the dermatologist a month before and said it was fine. And so I, told the ENT about it, and he told me to get it biopsied. So I got it biopsied, and I became a 3C. And I had surgery, I guess it was in West Sac. Dr. Ledgerwood, he removed the mole and told me that on the top it wasn't cancer, but it was cancer below. And then in 2015, I found out that it metastasized to my spleen and my liver. So that's when I, had to have, or actually, let me go back. When I had my surgery for the mole, I had to have 25 radiation treatments, and they did it here and this way. And I lost, sense of taste, and I have dry mouth constantly, and hearing about acupuncture, I think I'm going to take up on it. Anyway, it metastasized to my spleen, and when it metastasized to my spleen, I got referred to Dr. Truong. I live in Vacaville, and she practices out of Vallejo. It's been wonderful. She put me on Keytruda first, and it shrunk my tumor like in half. But then as months went on, it didn't work as well. So then she took me off and put me on a trial, the S1320 out of UC San Francisco. And then from there, last February, I woke up and I felt worse than you would with dehydration. And I fell twice, and my husband wanted me to take me to the ER, and I said, no, it's just dehydration, I'm gonna be fine. Well, we went to the emergency room, and I didn't have blood pressure, and I didn't have temperature, and about 1.5 hours later, they found out that my spleen had ruptured. So I was in the hospital and had the surgery, and never thought I'd have to use a walker, and had to use a walker for about 2 weeks. And then 2 months after my spleen surgery, on the incision near my belly button, this little bump like a blood blister. I went to the dermatologist, and she said, she biopsied it, and it came back and made me stage 4 melanoma. And, but prior to that, I was on the 1320, trial, and it was pill form, and it was wonderful. You know, you had to take one in the morning and 2 later on in the day, and it was great. Well, with the cancer growing outside on my incision, we had to stop it. And I had to wait like 4 months, and I, you know, go to Dr. Trong. It's like, come on, we ought to do something. Can you cut it off? You know, it's annoying. Well, she got me on a treatment of Keytruda, not Keytruda, Yervoy and Opdivo. And within 4 days of the first treatment of having the two together for 3 months, the cancer went away the live cancer just dissipated. And I'm currently on it, and now I only have to take a Opdivo every other week, every 2 weeks. So, and part of life going through this journey, I lost my sister 2 years ago to the same cancer, and we have the mutant gene. And when I was having surgery, having the mole removed, my sister was diagnosed that she had melanoma stage 4. And hers unfortunately got into her brain, and she had seizures, and you know, she passed. Well, I consider her to be my guardian angel, looking down on me and, you know, helping me through my journey. And I couldn't do it without, you know, up there's help and God and support of friends, great doctors, and you can't give up. You gotta just keep going, and it's a way of life. And when you can push yourself more, you learn to know your body well, and you know when you gotta, you know, have slow time. And I thank you and feel very honored to be up here talking to you guys, and I hope your journey can be as successful as mine. Thank you.
There and said, take a look at this. I don't know what it is. And he said, yeah, it might be a wart. Oh, okay. Well, he cut it out, had it sent to the pathology, got a report, called us in, and then it's those things that you always hear, those 3 words. You've got cancer, and then started rattling off all of these numbers, and metastasized, malignancy, all of that, and you know, wow. So kind of got our head wrapped around that a little bit and said, well, I got to get home back here to California where I can see my people, my doctors and family and friends. So as we made that journey back across the country, you know, we talked about, well, how is this going to change our life? We can't do this. We're going to have to get settle in our house again and just sit and deal with this. But somewhere, I think probably on the Pennsylvania Turnpike, I think I come to the decision, you know, we enjoy this lifestyle and we're not going to stop. We'll do what we have to do, but we're gonna continue this. And so we did. We got back. We actually, the first oncologist we saw in 2005 was Dr. Fehrenbacher, and never forget the first comment he made when we walked in. He said, well, you don't need to see me, you need a surgeon. I said, oh, well, I'm sorry, I'm kind of new to this. I didn't know the protocol here. Anyway, we did. We see the surgeon. He did, you know, the clear margin thing, all of that. I can identify with that because they really had to carve a really large section out of the bottom of my foot and did all kinds of scary things to it. And at the same time, they did that, as we've talked about, the sentinel node biopsy thing. That was positive. so then they took a cluster of the lymph nodes out of my upper leg. So did all of that, and then put me on. At that time, I think about the only thing going was interferon. So I was on interferon for about a year, and I don't know if anybody's experienced that, but that's really severe chills and shakes, and I mean that was horrible. Anyway, we got through all of that, and things went along pretty well. And then, really, just to jump ahead, we was just kind of on and off different. I've kind of been through pretty much all the treatments. I think I did the heavy cancers. I don't know, treatments where you lose all your hair and all of that. That was about the only other thing they could do at that point. And I was on a clinical trial. It was a pill, and I don't know, I can't remember the name of it, but anyway, combination things. Each thing just kept me going. At one point during all of this, I had it always affected my lymph nodes. I had 5 lymph nodes in the pelvic area that were involved. And at that time, we were down south, in Riverside, oncologists, and had all different kinds of treatments. There was anyway, whatever it was, I was in the hospital for 6 days at a time, getting continuous 24-hour infusions and such. And got through all of that, and then as the years progressed, we wound up back up here because things were getting a little rough, and I decided, well, we needed to be up here with family and friends, good support group. And that was in 15. Gotta look at my wife, she's my date keeper. And we was on the Year Boy. And for me, that was really, really bad. A lot of folks, I think, did well. I didn't. I came up here, and I always say I would have had to got better to die. It was really bad, and I developed this stuff in my lungs. Went to the pulmonary doctor. She looked at it and she said, "Well, your lungs are full of cancer." I said, "Oh, well, that can't be good." So he said, "Well, to be sure, we'll do a biopsy." They did a biopsy, and it came back as a organizing pneumonia, really rare. And so she wasn't sold on that, but she said, "Well, we're going to put you on prednisone, and if nothing else, you'll feel better." Well, eventually that cleared it up, and then it turns out that one of the rare side effects of the Yervoy is this organizing pneumonia. But so they stopped that, and then I started on the Obevo, yeah, and that worked really well. And so since it was on that, and that pretty much cleared things up inside, and currently I'm on the TVEC things. I have the lesions on my lower leg, and we get the injections, and I've been doing that quite a while.
I think almost 2 years.
Almost 2 years, yeah. And everything's going well. The side effects are minimal, if any. But I guess the thing is, through this whole journey, I think I decided, well, up in the morning, I looked in the mirror and I said, well, I have cancer. I can't do anything about that. But I might have cancer, but it doesn't have me. And I'm gonna live my life. I'm gonna do the things I enjoy doing. And we have. So as I said, we enjoy traveling, and we have. So since I've been on this journey, we've RV'd to every state in the country, in the States, all lower 48, parts of Canada, Mexico, and we continue to do that. We get, I get treatment every 2 weeks. In between time, after treatment, we'll take off. The bus is idling, and so we'll go out and jump the bus and go somewhere for a week, 10 days, so we get back. And in fact, before Kaiser started doing the TVEC, we was going to Davis, UC Davis. They were done, it was farmed out to them. And so that was, of course, in Sacramento. So sometimes after treatment, I had some really excellent nurses. I can't say enough about nurses. Anyway, this nurse up there, and we enjoy wine also. So we would talk about wine. So a lot of times after treatment, we'd come out of there, we'd jump in the car and go to a winery. So hey.
I'm going to pretend I did not hear that.
She says no drinking.
Well,
So you do this time.
Anyway, works for me. and it's worked well, I think. So anyway, I tell you, it's been a journey, and I don't know, sometimes I see friends and that with back problems and knee problems, and they're barely moving around, say, hey, I get around real good. Gee, at least all I got is cancer. I'm good. So anyway, I think that's my story, and I'm happy to be here. I'm glad to see this. It's great. Thank you.
My name's Dave. 2011, my wife Cindy had been pestering me because she's seen some moles underneath my hairline and on my back. She actually was pestering me probably since 2005 for that. But finally went and see my primary care doctor, mentioned it to him, and thought he'd just say, oh, it's nothing. And main one she was looking at was one still here to this day. It's on the side here underneath the sideburns. So he looked around, and he gets back behind my neck, and he says, what's this? I said, well, how the hell do I know? I can't see back there. And so he had me go downstairs in Vallejo Kaiser, get a picture taken, which they forwarded to a dermatologist. And I was going downstairs to get some antibiotics for the whole reason I went to go see him. He said, this way here we can have the dermatologist take a look at it. If they want to set up an appointment later on, they can do it, because I've been with Kaiser since 1974, I think. Maybe I went 10 times up to that point. I just felt if I wasn't really sick, there's no sense going. So he told me to go get my medication, go take the picture, come back up, and we'll let you know when your appointment is. So I came back up, seen the receptionist. I had a doctor who wants to see me. And I gave her my name, and she went running back there to where the offices are at. And he comes running out. He goes, quick, you're 5 minutes late for your exam. And I said, okay. So he had already set up with a dermatologist. She looked at it, took a biopsy, sent it in, said, well, you should know in a couple of days. Turned out being malignant melanoma. So within the next day, I went and got it cut out. No problem. They did the analysis of it, and they had all clean edges. Everything was good. So from 2011 to 2016, I went and seen the dermatologist twice a year to start with. Everything looks good. And if anybody has done a full body exam, it's kind of embarrassing, but something you have to force yourself to go do. It amazed me how much time they spend looking at the bottom of your feet and between your toes because, you know, never thought to look there. But she did, and I had a clean bill of health. And in the meantime, in 2015, my wife had got diagnosed with something called CLL. It's a chronic form of leukemia. And it takes a long time for it to get to a point where they can do any treatment for it. But I guess I'd be damned if I was going to let her get ahead of me. 2016 in September, I rolled over in bed and broke a rib, or cracked it. And so for the following month, we come on going back to Kaiser trying to get stronger pain meds because it really hurt pretty bad. And I don't really, pain doesn't really register with me. I mean, I've been active my entire life. I'm a real high-ranking black belt in a style of martial arts that I've been in since 1970. I've always gone fishing and hunting. We've always worked out all the time. I was into bodybuilding for a long time. And so we were always real physical. Little bumps and bruises, they'll heal. But this thing here just really ate my lunch. And so on one of the subsequent visits, one of the doctors said, you know, we haven't got any real good x-rays of you since 2011. And even that one's kind of fuzzy. So he set me up to get a CT scan. And it was on Monday, October the 3rd at 5 o'clock. We were in the emergency room earlier because the pain was still going on. She wasn't standing for it. And this was like, I think the first time she ever went to the doctors with me. And the doctor at that time said, well, first she said, maybe you just need to stretch more. You know, you are getting older. And I said, well, I guess so, because I believe when the doctors say, I know what I know how to do, and I believe they know what they know how to do. So I follow their direction. But my wife wasn't going to stand for it. Had the CT scan moved up to the time we were there. So we went through it, no big deal, come back, sit inside the ER. And another doctor comes back in and says, you've got numerous tumors in your body. We're going to have to do a biopsy to see what kind of mutation you have, but it looks like stage 4 cancer. And I said, okay, well, what are we going to do to fix it? So then I don't know exactly how long it was before Dr. Trong seen us. It wasn't that long. That CT scan that we took was like on a Monday. Dr. Trong had met us and then it got me into radiation therapy immediately the following week. And just in that week's time, the tumors had grown so large that they didn't think I was going to make it. My family didn't. Dr. Trong never said anything like that to us, but I think my family didn't plan on me being around till Christmas. The way that the radiation impacts your body, I mean, I've always been somebody that could put on a lot of muscle mass. I've always had a lot of tendon strength. A week or two into it, I had to have my brother come over and help my wife get me into a wheelchair so we can go out to the car to make it for the radiation treatments. So it's pretty debilitating, but I just figured it's what we got to do, so let's go do it. Dr. Trong wanted to get me into a clinical study, but she had seen how fast it was growing, and there's certain protocol that had to be followed, like getting mugga tests and what have you, and she didn't want to take that time, so she got me into the drug that the study was using, probably the same thing as you were talking about, the Taflenar and the Mechanist, where you take like 2 of them one time in the morning and 1 of them in the evening. I was on that for a while. The worst thing I remember feeling about it, aside from the fact that you just didn't have any energy to go do anything, was that it's like my internal thermostat was gone. Typically, if you're sitting there and you feel a chill, you put a sweater on, it's okay. By the time you felt that chill, it was too late. I'd have pajamas on, then I put sweats on, then I put a real heavy sweatshirt on, and then I put wrap myself with a blanket, and then wrap myself with a electric blanket, turn it on high. And it'd take about half an hour for your teeth to stop chattering. And then the bad thing was, once it got nice and warm, you'd fall asleep, and if there wasn't somebody there watching you, then your fever would go up to like 102. And I think that's the only fever I had as a relation to it, was that back and forth. And then they had done another MUGA test and saw that there was some inefficiency in my heart function that wasn't there before. Went through a chemically induced stress test, which is pretty cool if you ever have to go through one, just seeing how your body reacts to it. But they determined it was the same thing, so they took me off the Tafenlar Mechanist. And then I got another ologist type doctor because of my heart. And they put me on Keytruda. And that was one dose every 3 weeks. It's fine. I mean, didn't feel anything really off of it. Had some itching, had some soreness, just overall joint-wise. But I figured I was going to go back to work within the next couple of weeks. And then she also put me on something for my bones because that's what the initial thing was, that the bone broke or cracked. So I was going through Zometa treatments as well to help me get my bone density back up, which it did. But it wasn't as long and drawn out for me as it was for you guys. I first seen the doctor in the first week of October. I was back to work in May. Because just nothing on daytime TV. But that's one thing I can say about it is even to this day, I've been rough on myself because I can't get back and do the same physical things I want to do. I've been out fly fishing before, since then. First time I ever had to use a waiting staff, and I didn't get very far, but I did. And my energy level isn't the same. My strength's not the same. And after talking to the doctors that I have and the team that have been taking care of me, they say it's, you're being too hard on yourself. It takes you a long time to recover from this. But still go to work every day. Getting back on the Stairmaster now, doing some weight training. But throughout the whole thing, no matter where it was in Kaiser, every person was there to make your experience as pleasant as you can call it for somebody having stage 4 cancer. There was not one time, whether it's from a receptionist to a nurse to a doctor, that they weren't totally concerned with my well-being. And I think that helps quite a bit because it just means I didn't have to get pissed off. But so far so good. We've stopped the Keytruda. I believe we stopped the Zometa. Have to go in for another bone density test in a little bit. And they've downgraded the conditions of my bone from osteoporosis to osteopenia the last time we did a bone density test, so everything's going in the right direction. So I had a lucky story, I guess. Okay.
My name is Cindy Tom, and this is my husband, 30 years. He got sick. You need to take care of him. The thing to do, though, if you're a caregiver, keep a journal, because they will never remember what they went through. I will open it up and read to him, and he'll say, "Oh, you've got to be kidding me." No, we went through quite a bit of stuff, but yeah. But he's very tired now all the time, so I don't really have any more story than that.
Thank you so much for sharing your stories. We so appreciate you guys being here. I think every person has such a unique story to share, and we're stronger by doing this together. And you're an inspiration to all of us. Thank you.
Very positive.